Right, guys, good morning. My name is Sabrina and I am an aesthetic nurse injector practicing out of Bellevue, Washington. I just got my coffee this morning and I am so excited to start the day with you guys. It's a nice rainy day in Seattle, but I am happy because I have my coffee. So I'm working for a plastic surgeon, and while he's doing his surgeries, I perform all of the aesthetic procedures. So today I really want to focus on the injectables like your botox and fillers, and feel free to ask questions along the way. I'm going to try my best to answer them in between appointments, but basically I'm going to go over what a day in the life of an aesthetic nurse is. So stay tuned. Right, so this is where I go and check my appointments for the day. That's really good for me to know what to expect and know when to reconstitute some new Botox, just really getting my day organized. So that's the first thing I do. So the number one procedure that I perform is Botox. And so we're going to talk about Botox. It comes in this vial here and it comes as a powder form. So you have to reconstitute it with bacteriostatic sodium chloride. Okay. And most practices reconstitute it differently. It usually ranges around 2 to 2.5. So for all my patients who have never tried Botox before, I'll tell them that Botox is a neurotoxin that temporarily restricts muscle movement, and that helps reduce and soften fine lines and wrinkles. So I'll typically inject Botox between the brows, the forehead, and the crow's. And the other areas you can do them are lip flip, you can hide your gummy smile, you can inject Botox for teeth grinding and clenching. You can do Botox here for your neck bands. People don't like that sometimes. So many places to put Botox. Popular treatment is filler. So filler is essentially hyaluronic acid, and that is used to add volume to your face. And the most popular treatment that I get with filler is a lip filler treatment. And I saved a syringe for you guys so you can see what it looks like. So I'll attach a needle to the top of this guy, and this is what I'll use to inject. And honestly, it's not a lot of product. It's a fifth of it all. It's a fifth of a teaspoon. So I let my patients know we're doing the full syringe because you will regret it otherwise. There isn't one filler for all. So there are different fillers for different areas to be treated. So you're not going to use the same filler here as you are here. Some are just more robust than others. This patient has volunteered to be on the story for today. Say hi. So he's here for Botox. So he is on social media very often. He's in a public platform, and these lines here on his face bother him. And make that mean face, lift your brows, and then smile really heavily. So we're just going to take care of some of that movement. This is going to really soften the lines around his face. First. Okay. And then make that mean face. Relax. Mean face. Relax. Make that mean face. Relax. Perfect. Okay. Lift your brows. Relax. Lift your brows. Relax. Lift your brows. Relax. Face me. Lift your brows. Relax. Lift your brows. Relax. All right. Okay, so we're gonna go over some post-op instructions. So we just finished our treatment for today. So I wouldn't recommend working out for the next 8 hours. Anything that induces sweat, like hot tub, sauna, that sort of thing, avoid that for the next 8 hours. Also avoid getting a massage, so laying your head flat. We don't want these to move. The patient know not to press on it. So my next patient, she is concerned with these lines on her forehead. So we're going to take care of that with some Botox. I let her know that since we're treating the forehead, we have to treat the glabella because these muscles work together. So we're going to do a total of 35 units there. Numerous inquiries about how to get into the industry, and I really want to help you guys out. So I'm going to give you 5 tips on how to get in. 1, watch YouTube videos. YouTube has a ton of information on Botox and fillers. I would look up things like, what is Botox? What does it do? How many units do you need in each treatment area? Fillers. What different types of fillers are there? 2, attend a Botox and filler certifications course. Now, this is important for a couple of reasons. 1, you get that hands-on experience, and 2, it looks really good on your resume if you have some sort of experience. Number 3, follow as many nurse injectors and medical practices in your area on social media. Like, comment, make sure you're really interactive, DM them, let them know you're interested in getting in the industry. And who knows, one place may be hiring and they'll remember you because you were so supportive of them on their Instagram pages. Number 4, get a LinkedIn profile. And again, add all of the injectors and medical practices in your area. Message them, letting them know that you're interested in entering the industry, if there's any shadowing opportunities, or if you have an opening, you're so interested. And tip number 5, I know this sounds really corny, but never give up. Guys, it took me a year to get in the industry. I reached out to numerous medical practices, had so many interviews, and didn't get in. And I kept persisting, and eventually got an opportunity in a different state. So I took it and eventually got in. So I hope it's not that drastic for you, but keep persisting and you will eventually get in.